Hello, everyone. Welcome back to my channel. My name is Urvi Sharma, and I'm a final year MBBS student at Maulana Azad Medical College, New Delhi. And today we have with us once again Dr. Toshali Pandey, an alumnus of Mansi. And for our newer viewers, our first time viewers, let me give you a brief introduction. She is presently working towards getting into residency in the United States, and she has always been a very bright student, scoring a brilliant 262 in the USMLE Step 1 and a 272 despite her very hectic internship schedule in Step 2. So today we are going to have a masterclass with her about clinical electives in the United States. I am very grateful to Dr. Toshali Pandey for sparing her very valuable time during interview season. And I'm sure this interaction with her will be of immense benefit to everybody interested in clinical electives in the US. So, ma'am, my first question is, what exactly are clinical electives? There are many terms that are almost synonymously used with clinical experience in the US, like electives, rotations, observerships, externships, hands-on experience, etc. So could you please clear the concept of clinical experience in the United States and all the related terms?
Hi, Urvesh. Thank you for having me here. It's always a great pleasure to talk to you. Yes, like you said, that there are many different types of clinical experiences. Broadly, you could classify them as hands-on experiences and those that are not hands-on. So hands-on experiences basically mean when you get to interact with patients, take histories, perform examinations, present cases, enter notes, interact with the electronic medical record system, basically do everything that a medical student in the US can do, is what a good hands-on experience would be. Whereas with other experiences that are not hands-on, you're typically just shadowing faculty or somebody else. So you can listen to their discussions, you can participate in rounds, but you don't get to interact with patients, and you typically don't get to use EMR as well. So under this broad classification, clinical electives and externships fall into hands-on, and in the other remaining types of experiences, you usually have observerships. Yeah.
All right, so externships also do come under hands-on.
Yes, externships are hands-on.
All right. So what exactly is the purpose of clinical electives and what is their utility for a medical student, especially an international medical student?
Yes, so clinical electives and externships are basically differentiated by whether or not you're a graduate. So graduates get to do externships and students, undergrads get to do clinical electives, which, like I mentioned, is basically doing what a student there does. So for international students, I think clinical electives serve three purposes. The first being you get to see the US healthcare system. Second, which is typically the most important, is to get letters of recommendation. And the third is to create a good impression at whatever university or hospital you're doing your elective to improve your chances of getting an interview or matching there ultimately. So those are three major things. And for most IMGs, getting letters of recommendation is usually the priority. Yeah.
Right. So it would be preferable to apply for electives at institutions where you want to match into residency.
Yes, that would be ideal. That is what students there do. But for international students, usually choices are quite limited, especially if your college doesn't participate in VSLO, then you're kind of limited to the universities that you can apply to. But yes, there are certain universities that do take IMGs as residents, and that are also good places to do your residencies as an IMG. So yeah, so doing an elective does increase your chances of getting an interview or matching there.
Right. There are also research electives. How are they different from the clinical electives?
Yes, so like the name suggests, research electives are designed to allow somebody who's rotating there to do research. It could be lab-based research, it could be clinical research. Research electives are also typically 1 month in duration. Johns Hopkins is a very popular research elective destination for students of MAMC. And so in this 1 month, you don't have a lot of time to do lab-based research. If you are trying to get a research elective, I would recommend doing a clinical research elective, basically research that is clinic-based or is not basically lab-based, because lab-based researchers take a long time to get results, whereas in a shorter duration of time, you can actually get the results out of a clinical study. And if you get the results, you can maybe have your name on it. Plus, you can always say that you also interacted with the US healthcare system. You may also get a chance to interact with faculty, clinical faculty, thus improve your reputation at that institute. So clinical research is something that I would recommend. But yes, research elective is one way to get letters of recommendation and improve your research CV. But yes, it's not the same as a clinical elective. The clinical elective cannot be replaced by research elective is what I would say.
Okay. So where can an international student or a graduate find the appropriate opportunities for the aforementioned clinical experiences?
Yeah, so depending on what your institute participates in, there are some colleges that I know that participate in VSLO, Indian colleges, and then there are some colleges that have tie-ups with different universities in the US, but they are rare. So for the majority of colleges, MAMC included, we have to apply to universities that accept applications outside of VSLO. So VSLO is like this application platform that you can access only if your college participates in. So I have this sort of list here. I'll just name the colleges that I have here that you can apply to.
All right.
But this is not an exhaustive list, and it's recommended that you go to their websites and check that they haven't converted to VSLO. So some of them are University of North Carolina, then there is Yale University, then there's Cornell, University of Alabama, Sinai Hospital of Baltimore, Cleveland Clinic, University of Chicago, University of Illinois at Chicago, University of Pittsburgh, NIH, Florida International University, Emory, University of Colorado, Case Western, Memorial Sloan Kettering. So this was just like a bucket list, but there are more. But these are for sure. Yeah.
Just to clarify, these institutions accept students outside of VSLO as well, right?
Yes. Yes. These are the ones outside of VSLO.
All right. Now, when and how early should one apply for an elective? I mean, how much processing time is required between the application date and the elective start date?
Yes, that's the most important question, because for most electives, it is a first come, first serve basis for choosing students. And I would say the minimum duration that you should keep for your intended date and applying for that elective is 6 months, but you can apply as early as 1 year for a lot of electives. The most important thing that you need to do is go to their website and find out when they are opening up applications for your specific month. Say you're interested in May of 2024. So you go to the site of, say, University of Alabama, find out when they open up applications for that particular date, and ensure that all of your requirements are complete, say by December of 2023. So on the day that they open up applications, you should have your application ready and submitted as soon as possible.
All right. Ma'am, these days there are many companies that are also offering US clinical experience for a fee. So what are the pros and cons of applying through a company rather than directly to an institution?
Yes. So I also wanted to add something to the previous question, and I'll just say it quickly here.
Sure.
I've noticed that for a lot of my peers and for some of my juniors as well, it's become really difficult to get the B1, B2 visa these days. there are very few slots available. So I would say that if you're interested in going for electives, apply for the visa as soon as possible, even if you're in, say, second year or third year. And when you get an acceptance from your university, then you can apply for an emergency appointment. But yes, so that was for visas. And for your question about having third-party companies set you up for elective, I would say the pros are that they usually set up everything for you. You don't have to coordinate much. They will tell you, make it easy for you, arrange for travel, arrange for lodging, things like that. And it's also very easy to know what you are going to expect. So it's not very difficult to do them. And I would say that they don't really want you to apply a lot in advance, not like 6 months or 1 year. And they usually always have slots available. So you can apply even 2 or 3 months before your date. But of course, you'd need your visa. The cons being that these are usually in the private clinics of faculty members of big institutions. So being in a private clinic, you usually don't get inpatient experience. And for different companies, they can offer different things. Some offer hands-on, some don't. So if they don't offer hands-on, that can also be a con, but of course, some do offer hands-on experience as well. One of the other major con is that the letter of recommendation is often not personalized. You would have to find out for every such company that you're applying through. The letter of recommendation may not be personalized, and often it's not on the letterhead of the university. It's simply with this particular faculty member's signature. So it doesn't hold a lot of value. Yeah.
All right. Ma'am, could you please elaborate a little on the visa thing that you were telling?
Yeah, so it's kind of hard right now. As far as I know, the embassy doesn't have a lot of slots for the B1, B2 visa. Some of the dates are going as far into 2025 right now.
So B1, B2
yeah.
visa is the visa that students usually take for clinical electives.
Yes, B1, B2 is what majority institutions ask for, and they will sponsor for it. So once you get an acceptance from an university, you can always ask them for a letter to sponsor your B1, B2 visa. They'll happily give that to you, and which you can send it to the embassy to show that you have this elective, which is why you need to get that visa. Yeah.
All right. So in India, how early can a medical student start with clinical electives in the US? What is the right time to do these electives, and how should one go about it, as institutional permissions for such courses are very difficult to get at most places, like in MAMC?
Yes, that's a very difficult question. It would vary with every institute, every college. As a general rule for the US, they typically take only final year students. They usually want your transcript for final year. So that often also means that after you've completed your final year examinations. But I think sometimes third year transcripts might work. But for our institution, for instance, we would have to provide our final year transcript. So we would have to be after our final year. Also, places that have VSLO can typically send students even during their final year. But again, it varies with every college. You would have to find out from your seniors, from your peers, typically not before final year. That is what I would say. Yeah.
All right. What are the essential requirements or prerequisites for applying for an elective?
Yes. So once again, I have this bucket list, and I would once again say that visa is right now a little bit of a problem. So you might want to consider applying for that first. And then the second thing that you should do, in my opinion, is get over with step one as soon as possible, especially since it's now pass and fail. And that will open up a lot of universities for you. Other than these two requirements, and visa, of course, is something that you don't need to have in hand for a university, but we'll come to that later. So after these two, then there's typically a final year transcript that's required, your CV, personal statement. There's also a letter required from the dean, which basically says that, yes, you are a final year student, or basically that you're an undergrad and you have the dean's permission to attend this university. Not all, but some universities also ask for TOEFL scores. Some universities will ask for your background check. Others will ask for immunization, letters of recommendation from other faculty. But these things, background check, immunization, letters of recommendation, can also be submitted after you get acceptance from the university. So you would have to check with every university what are the requirements, what are their requirements, and which requirements you need to provide at the time of applying and which you need to provide before starting rotation. Yeah.
Right. And the permission of the dean of your institution is mandatory.
Yes. So for most institutes, or maybe even all of them, they do require dean's permission, saying that you're an undergrad and that you're allowed to go there.
Right. How important is step one in applying for clinical rotations? How much are the opportunities for those who do not yet have a step one score or a pass fail?
Yes, I would say step one is mainly seen as something that's like a checkbox. If you've done step one, you have more universities you can apply to. I would say scores don't really matter a lot. Like I said, first come, first serve is important, even with those institutes that look at your step one scores. But yes, having a good step one score would help. But now that it's pass and fail, I don't think that would hold too much value again. Some universities don't require step one scores. Yale doesn't require it, for instance. Yeah, I can't remember which others don't, but there is a handful that doesn't require step one, that don't require step one scores. And so if you haven't given step one yet, you can still start applying. Yeah.
Right. So if I do an elective in one specialty and then apply in a different specialty, what are the implications of that?
Yes. So for certain specialties, for instance, let's say pediatrics and medicine, there is a lot of overlap in terms of the clinical experience. So yes, you could mention your pediatrics experiences for your internal medicine application when you apply for residency. But yes, there is a caveat to that, and that is mainly that it shows that you're not entirely decided which residency you want. It may show that you're not completely focused on, say, internal medicine or pediatrics. That is one thing that I think is not good about doing different kinds of experiences. The other thing is, if you decide later on that you only want to do internal medicine and pediatrics was something that you didn't, something that you initially thought of and then you changed, or it was the only thing that was available, then yes, of course, you can spin it that way during your interviews, but you need to have some kind of explanation as to why you did something in another specialty. Neurology, I would also say, will work for medicine and vice versa. But say for surgery, I don't think it would help doing an elective in medicine and vice versa. Yeah.
Right. So, ma'am, how costly is doing these rotations? The fee, the traveling, and the living expenses, etc. And how can one minimize the cost of these electives?
Yes, electives unfortunately can be really costly. There are a lot of hidden costs involved, costs that you incur throughout of your med school while applying and things like that. And then there are some costs surrounding the elective duration. I'll mainly discuss the ones that are required for the elective per se. So different universities charge different amounts, but I'd say the average would be around $3,000 or $4,000 a month. Added to that, typically what would be our biggest expense is travel to the US. So the tickets I booked for December, for instance, round trip cost me around 1.8 lakhs. It was a non-stop flight to
Right.
the US. So you can find cheaper flights than that, but yes, this would be arguably your second biggest expense. Other than that, it's finding lodging. That is very variable. You can find anything from $600 per month to $1,200, $1,300. Lodging is something that you can minimize your costs with if you apply for it early, so that you don't have to go for the more expensive ones. And same for your flight tickets. If you know early on where you'll be going, you can apply for it early and get a cheaper ticket. Yeah.
So, ma'am, what is the final cost of a rotation in the US?
Yeah, so for me, the cost was around, again, $3,000 to $4,000 total, but that was because UNC only charged me $2,600 for the elective. There are some electives that are free, but they're difficult to get into. Yeah.
Ma'am, how to differentiate between electives? What criteria or quality check, if any, should be used to select or reject an elective opportunity?
Yes, I would say as an IMG, you don't get too much choice, and getting any clinical elective at any university, not through a third party, applying directly to the university is an excellent opportunity. Doesn't matter if it's at Yale or the University of Alabama. Most university programs are very, very good. And so don't don't worry about whether or not it would be a great experience between these different universities. But when it comes to applying to third-party companies, I would say that is definitely of an inferior experience as compared to these universities. After that, I would place externships and third-party electives. I would place at the same level. And after that, I would place tele-rotations. There is one thing that could help improve your elective experience or increase your exposure there, and that is doing an acting internship or a sub-internship. I've noticed that this is an opportunity that not a lot of people make use of, but if you can get an acting internship or sub-internship, it would give you direct exposure to their internal medicine department instead of a subspecialty, say like gastro. And it also usually means more responsibilities, similar to like what we do in internship here. You get to do that
Right.
there than just be a medical student. Yeah.
So, ma'am, what exactly is this sub-internship?
Yeah, so as you know, interns there are first year PGs. So a sub-intern is basically a student that works under an intern and shares responsibility with that intern for a patient. That includes the entire management of the patient, writing orders, getting a patient the treatment that they need, basically being a first-year resident, but with a little less responsibility and working under supervision of a first-year resident. Yeah.
So, how can one do this sub-internship?
Yeah, so the application process is usually the same as for your regular clinical electives. It's just that for some universities, they say they'll give sub-internship to only those applicants who've already done one elective somewhere in the US or done an elective at their institute itself. Yeah.
All right. How much clinical experience in the form of such electives, observerships, etc., is required for residency application?
Yeah, so I would say as many electives as possible. There's no such thing as too many electives, but what is required, I would say, basically at any point when you get, say, 3 or 4 LORs. 3 US LORs is usually the safe number. If you get good 3 US LORs, by good, I mean, say from a university program, or you could get that from one elective, you could get that from 3 electives, but 3 US LORs is what is, I would say, the required amount of elective experience, however much it takes you.
Right. Ma'am, now ever since COVID disrupted our lives, telerotations have come into play. So how different are they from the in-person rotations in respect of the cost and usefulness? And are they still worth it after COVID restrictions have ended and rotations in the US have started again?
Yes, so that's a great question. Like I mentioned initially, telerotations would come after in-person rotations, including third-person externship, even observerships. I would say telerotations would come after that. There are telerotations that can offer you elective experience, so that is definitely a plus point. And having no experience is having telerotation is better than having no experience. Of course, like you mentioned, the cost would be much less for telerotation because you won't have to spend for lodging, for tickets. I'm not sure how much universities or institutes charge for telerotations. I'd say it would be a little less than your regular electives, but not sure how much of a difference there is. So you basically sit at home and you can do these electives, but once again, you're not there in person. They will definitely hold much less value as compared to an in-person elective. So if there's a candidate who's done one in-person elective and you've done 3 telerotations, an interviewer would still see them as somebody who has more experience than you have, right?
Right.
So yes, so I would say that if you are not getting any option, doing telerotation is a good idea. Yes, so yes, that's my verdict on telerotations.
Can telerotations be done before final year as well?
I'm not entirely sure if you're doing an elective using a telerotation, then probably not. The same requirements should be in place for telerotation as well.
All right. And would dean's permission be required for telerotations as well?
I've personally not done a telerotation, but I think so, yes. An institute would require a dean's permission saying that, yes, the student is doing something here. So it's more of a principle of informing the dean of the institution that your student is at our institute virtually or in person, and these are their activities. So yes, I think they would require permission. If you're a graduate, then I don't think you would require dean's permission or anything of that sort, but you probably won't get elective experiences.
Right. So, ma'am, is it possible to match only with telerotations even now?
Yeah, so that's a hard thing to say. I would say it is possible, yes. It's not impossible for sure. But during the pandemic, all programs were aware that it was very hard for IMGs to get experience, so they would have taken into account that factor. So they were probably more accepting of telerotations. But more than that, I just think it's competition. If you apply next year, for instance, there will be much more number of IMGs who have had in-person electives, and you have to compete against them. So your telerotations are useful, but it is you have to compare it to what other candidates have. And if they have something superior, then yes, you would have less of a chance as compared to them.
All right. Now, my last question is, are there any residency programs in any specialty across the US that are ready to admit international students with no US clinical experience whatsoever?
Yes, of course. There are programs that will do that. Like I said, it is possible. But your choice would become very much limited. Not a lot of programs might reach out to you if you don't have US experience at all. Yeah, so you would have quite limited choice. You might not get the institute that you want. You might not get a residency that you're happy with, because there is a lot of variety. There is a lot of difference in the residency experiences in the US. So that is something that you would have to factor into account. But yes, for sure, there are places I'm sure that would take residents without having any US clinical experience.
All right. And in the end, ma'am, I'd like to ask you to share your experience rotating in the US.
Yes, of course. So it was great rotating at University of North Carolina. I did two electives there, one in pulmonary medicine, one in infectious diseases. Um, yeah, I would also say that that my second elective I got not by applying through their website, by actually talking to the coordinator there. So that is something you can obviously do if you get one elective at an institute. You can go there and physically arrange a second elective, which is always a great idea. A lot of my peers have done. Other than that, I got excellent lodging. I got great faculty who wrote me great LORs. I managed to get 4 LORs from 2 electives, which I thought was great. I didn't really have a lot of time after that to do any more electives because I was about to get my degree.
Ma'am,
So
what was the duration of your LOR, of your rotations?
yeah, so there were 4 weeks each. Yeah.
All right, so 2 months of clinical rotations.
Yes, 2 months of clinical rotations.
All right. So with this, we would like to give a pause to our discussion, and I'm sure we'll meet again with some other useful topic. I would like to thank Dr. Toshali Pandey for sparing a very, very valuable time. And I'm pretty sure all future aspirants will benefit from the comprehensive information about clinical electives that she has shared with us today. And any parting words that you'd like to share.
Yes, of course. So that would be that this is just my experience. This is just my knowledge. There have been a lot of IMGs who have put up a lot of information on the net, including videos. So definitely check them out as well. And you're sure to find different and new stuff there. Yeah.
All right. Thank you, ma'am, and all the best for interview season. And thank you for joining us today.
Of course. Thank you so much for having me here.